There he is.
Hey, man.
How you doing?
I am good. How are you?
This is yes. I'm great. How are things going?
This week is nuts, but otherwise good, surviving. It's
Like
best
nuts
I
on
can.
clinics?
No, I'm not on clinic. It's just apparently all of the deadlines are happening this week and next week, and my dean piled an extra giant responsibility on top of
You're live when we're recording.
yeah, I know. So it was a last minute request for somebody that just retired, and anyway, yeah. So it's busy, but all good.
Awesome. Well,
Yeah.
I'm super excited to do this with you. And yeah, we've got a couple things here. So we do these online.
Yep.
We sort of recognize, so this is one for you and one for people watching, there's only so much that we can answer without being able to look at your pet in person and review records. And so our ability to give you probably all the questions, or excuse me, all the answers that you're looking for is going to be limited, but we really try and be as useful as possible within those confines. So seizures, balance problems. We've got some questions about tremors and stuff like that today that, I just try and answer questions and help these people as much as possible. So in general, I try and stay out of it and let you answer the questions.
Oh boy. All right.
So you'll be on the hot seat.
That's
And
great. You should have told me this ahead of time.
so I guess tell everyone a little bit about who you are and where you're at and what you do.
Yeah. Hey, everyone. Yeah, I wasn't sure what the format would be like, if who we would see and such. So
yeah, so this is live on Facebook right now, and all like 4 people that are interested in neurology are watching right now. But it'll be recorded, and as you saw, we get people kind of from all over that have questions. So
yeah, fantastic. Yeah, so I'm Chris Mariani. I as just like Dr. Wong here, veterinary neurologist. We go way back, actually. Gosh, it's at least 25 years, right?
Oh gosh, we're not that old.
It's pretty close, man. Sorry, we'll scrub that part. But yeah, so I did. I'm Canadian originally. I did vet school in Canada. I did a lot of my training at the University of Florida, which is where we met originally, when Dr. Wong was a student, actually. Mm-hmm. And so that's what I mean. We go back a ways. And I stayed on at Florida afterwards and did a PhD because I am a sucker for school. So my interests, more specifically in veterinary neurology, are actually in the world of brain tumors, encephalitis, and I dabble in epilepsy as well. But I run a research lab where I am currently. So after I finished up all that training at Florida, I came up to North Carolina, and I'm currently at North Carolina State University, where I spend my time on clinics, as well as teaching students and residents and interns here in the hospital. But I also run a research lab, again, focused on primarily on brain tumors and encephalitis. And so I have a bunch of interest in those areas. And I can talk all day long about that stuff, but I won't.
Well, yeah, it doesn't look like we have any questions about brain tumors, but people put questions in the comments and, see if there's something that goes there. Yeah, so it would have had to have been maybe 2002, 2003 that we met, because I graduated in 2005.
Oh yeah, I guess. Okay.
My recollection of it is it was, before UF had redone their hospital. So it was still, the old small animal hospital, and Cheryl Chrisman had all of these photos on her door. And, I was a budding neurophile at the time, and, Cheryl was looking to retire, and Roger was, getting a little more senior in his tenure there. And I just remember there was this picture of this long-haired guy with his arm around someone else, that the two of them were, I think, dressed in green and holding beers out like this. And so I remember seeing that picture over and over on her door. And it had to have been, just me hanging out as close to the neurology office as I could. And, when you were doing your PhD, you'd cover time for the for the service. And we probably talked for, 2 hours from 7 o'clock to 9 o'clock that, you were on clinics and basically we're done with the day, but I came in and was all interested. And so for anyone else wondering, Dr. Mariani, he hooded me for graduations. It's kind of, you kind of pick the person that had influenced you a lot. So that was this guy. So Chris, I owe you a lot, and much gratitude for what you've done for me over the years. So
oh, of course, yeah, those were the days. Yeah, I remember the picture. Sadly, with COVID now, I look almost the same.
that's a good thing. All right, it looks like Kayla and Dave have arrived, and so I'm gonna bring her on in. Kayla has a 1-year-old neutered mixed breed dog named Dave that was treated for Ehrlichia 3 months ago. Never had any symptoms, but he's had some tremors and ataxia, and she's got some questions about that.
Hi guys.
Hey.
Hi. Thank you guys so much for taking on my question.
Of course.
Yeah, you're welcome.
So I do have my Dave here. He did, like you said, he was, I adopted him up back in August, and then I went to his, free health check. I was like, oh, I'll get him tested. And they're like, oh, he actually has Ehrlichia. And so we treated him with 1 month of Doxy. Never showed symptoms for that. And just recently, after New Year's, started having these little tremors. So he would kind of, it was a sudden onset. We were over at a friend's house, and he first vomited and then started kind of bobbing his head up and down, walking that drunk walk, ataxia. And I waited 5 minutes to see if it would kind of go away. It continued, took him to the eVet. They thought it was just probably a toxin, told me to send him home, kind of triaged us, sent us home on our way. And then where he has had 2 more episodes since then, each one in different places. So the second episode happened about minutes after we came home from our 3-mile walk. And then the third episode happened after coming home from work. Nothing, he hadn't been outside at all. So no toxins that we know of that he ingested. And just every time that it happens, it lasts about 10 plus hours. So, and then once it goes away, the next day he has a slight head tilt and he's almost compulsively itching. Like he's just nonstop itching himself. And then, but after that, he's running around, playing, have a grand old time, eating, drinking normal. His stools do end up a little runny, not like super runny, but like a little bit more cow pie consistency the next day. But other than that, stools have been completely normal as well. And the only vomiting is during one of his episodes. And so, and his blood work came back normal, except for his Ehrlichia titer that was 1 to 80. And then other than that, upon vet exam, when we took him to the vet, they said, really, we don't see anything. He's not buckling. He's doing everything. We don't see any ear infection. So I guess my question for you guys is there any neurological things that can happen that would cause them to kind of have these episodes of ataxia and tremors? And then also, could it be the Ehrlichia? And is this a long-term, like what am I looking for as far as like long-term side effects, even after a treatment of Ehrlichia? Is this something that is going to continue going forward?
Yeah, well, nothing like starting off with a softball here.
Yeah, sorry.
No, it's
My vet was like, kind of like you, neuro. So we do have a neuro appointment on Wednesday to kind of see them, but they just kind of, yep, go to the neuro. So it's I don't know kind of what's going on. And then also, I'll add in that when we adopted him, he does have stenotic nares. Upon adoption, they said that they thought it was from birth. One vet, the vet that first diagnosed him with the Ehrlichia, said that it looks more to her like a trauma happened to his nose because it's more on the upper opposed to the nasal cavities going inward. It's more of the top kind of unable to. So he does snort and snarl and make a lot of noises.
Yeah, and he's a young dog, as I recall.
Yeah, 1 year old.
1 year old. And what kind of dog is he?
Embark said village dog. I don't even know if that's a breed. It's pretty much he came from Mexico. He's a street dog from Mexico.
Ah, interesting. Okay, and where are you located?
I'm actually sorry. I should have told you guys. I'm from Gilbert, Arizona.
Okay.
And valley fever came back negative as well. So I know that was kind of something that could be a potential here in Arizona. And that came back negative.
Yeah, something we don't see on this coast, really.
No, you don't.
Yeah. Well, those are pretty unusual signs, I would say. I mean, what you're describing strikes me as a problem in this region, sort of further back. So they don't sound like seizures to me. At least not typical seizures. Here he
is. He had to make an appearance. If you can look, he doesn't have a nose.
Yeah. Seizures can manifest in a whole bunch of weird and strange ways. It doesn't sound typical. The other thing I wanted to ask is, how far apart were these episodes?
So his last one was on the 15th. These were exactly 1 week apart, each one, which I thought was peculiar for me. I was like, it happened Friday, Thursday, Friday. So about 1 week apart from each.
Right.
And then he hasn't had one in, hopefully, knock on wood, 2 weeks.
Yeah. Okay. And it sounds like right before they happened, these episodes he was active, at least the one he was after a walk.
Yeah, he's completely active. The first one happened right after we took him to a friend's house for the New Year's so he wouldn't be scared of the fireworks. So he was playing with her big dog, and they were wrestling and having a grand time playing. And then I had just gotten home, so he was running around. He greeted me at the door. No lethargy or anything like that from him at all prior to the episode.
Yeah. So there's a lot to unpack.
Sorry.
And Mike, you just keep me in line here, but time-wise and all that, but because I can talk for hours. But they don't strike. They're certainly not typical seizures.
Okay.
It could be a seizure-like event, but they're certainly not typical in how it sounds like they look. Am I echoing badly, by the way, or is this okay for you guys?
Oh, this is great for me. Yeah, I'm good.
I'm just getting an echo on my end, which is why I asked. So the duration of the events, like lasting 10 hours, is really unusual in of seizures, and also the fact that he was relatively active. Most seizures in dogs happen when dogs are at rest or sleeping, as opposed to being more active. And so that's sort of constellation of things, as well as the nature of what you described, like sort of a tremor and ataxia. It's just not that typical for seizures. So for me, I think that it's more likely to be something else. The problem is it doesn't sound typical for any of the other things we tend to think of. So there's a wide variety of what I usually call seizure mimics, things that can, look like a seizure, but aren't. The one people talk about a lot is syncope, which is basically fainting. So a lack of blood supply to the brain. Doesn't sound typical for that.
Tincturing it too. I don't know if that has any.
Say the first part.
sorry, his gums are, every time I look at his gums when it happens, they're really, really pink, like they're bright pink. So it looks like there's a lot of blood flow going there. His capillary refill time is less than 2 seconds as well.
Yeah. The what you're describing sounds to me like a problem with the back part of the brain. So areas the cerebellum and or the brainstem, which control things like balance and movement. And so tremors, you can see tremors with cerebellar problems because it fine tunes the movement. And sometimes that's prominent when they move their head, they sort of do this thing, but then when they're at rest, they don't tend to tremor. So it's associated with the movement. And that would potentially go along with the balance. So episodic sort of problems with balance and cerebellar function is pretty unusual in dogs. You can see it sometimes so what I'm thinking is, I'm wondering whether it could be a transient blood flow issue in him. The problem is that lasting for 10 hours is, like we'll see this in dogs. It often lasts for sometimes seconds, sometimes minutes. We sort of liken them to this thing in people. They tend to call them transient ischemic attacks or transient ischemic events. They're kind of like a mini stroke, if you will, that happens. So I don't know. I'm wondering whether something like that could be playing a role. And the other thing that's unusual is we don't tend to see those in young dogs typically. It tends to be a problem in older animals. But you can see it if there's some other underlying issue, or, maybe if there's some sort of congenital malformation with his blood supply or something along those lines. I don't know. We're kind of getting out there, but it's in terms of, unusual things, but this is an unusual sort of set of clinical signs to me. I don't know, Mike, what are your thoughts on this?
Like when I do see it, like it does look like, when I like Google like toxology or like a toxin, because when I went to the vet, the eVet, when they triaged me, they were like, oh, it looks just like a THC exposure. And my friend has a med card, but like the third time we don't have any THC here. So I was like, it can't be that again. But it looked almost identical to that. Like if you YouTube videos of that, that's exactly what happens, and it lasts so long. And it does happen. He kind of just wants to lay in his bed. He doesn't really want to get up and move at all either. He's very kind of like, no, I feel more comfortable in my bed.
Yeah, I mean, for me, this is a tough one to start off with. Just the challenge is when it's episodic like this, when they come into the veterinarian and their exams normal, they're acting normal in between. There are certain things that we think of. Certainly seizures is one of them, but like Dr. Mariani said, it's not our classic seizure. So we start thinking of other things that can cause episodic weird stuff, for lack of better terms. So heart and lung problems, what Dr. Mariani was saying about syncope, toxins like you alluded to. I guess there are certain metabolic things that can cause, to me, tremors and ataxia. I guess I usually wouldn't think of the scratching, and I wouldn't think of them lasting for 10 hours, but and most of them would come up on blood work, like low blood sugar or electrolyte abnormalities, etc. So part of for me would be getting a good listen of the heart. Part of it for me would be potentially x-rays of the heart and lungs. Even though he's young, kind of most of the heart related things that we think of usually don't happen in young dogs, but there are some heart related things that can cause episodic spacing out, wobbliness, incoordination, things like that. But this is one of those that I certainly, I guess, kind of keep my mind open. I don't know how much you can see of my hands. Keep my mind open of all the things it can be, and just try and be very systematic of ruling things in and out, but being prepared that at the end of it, I might cross off 100 things that it could be and still not know exactly what it is. But the rationale for me is, well, let's get rid of the worrisome things from the list. So I'm sure that the neurologist, when you meet with them on Wednesday, is going to have some thoughts with regards to what tests, could or should be done to try and narrow it down. But you've got a really smart neurologist and a really okay neurologist that don't know off the top of their head what it is. I guess I'd be prepared. There might be a lot of questions that they're going to ask and try and figure out. So
it's like with the Ehrlichia, are we kind of, because I'm like reading this and I'm wondering, because I saw that it's like there's acute phase, there's the subclinical phase, and then there's the chronic. When do I know, or is this like a symptom of chronic, or would it be more like would he be progressively getting worse opposed to being completely normal and then having these, like, wouldn't it be episodic if it was ehrlichiosis or something similar?
Chris, I'd be interested in your approach for that Ehrlichia positive, or whatever tick-borne disease positive it is. How you factor that in with?
Yeah, I think it's probably a red herring. It's possible these diseases can sometimes smolder and do weird things, but I think that is probably just an incidentaloma, if you will. It's like I think it's just a red herring, and probably not related. Some of the tests that you may discuss again with the neurologist you meet with may be able to investigate that a bit further, like collecting some spinal fluid, for instance, and or imaging the brain, which may be a good idea to investigate some of these things we've been talking about. But for me, I think it's unlikely to be Ehrlichia. I think it's very unlikely to be a toxin. We see toxins with some frequency, and if that were a single event, I would say that's pretty high on the list. But 3 separate events being normal in between, I think it's not impossible. But if you don't know a potential source and he's with you and not wandering, I think it's probably not a toxin. So
a little vacuum though, so we do worry about that. But my other, I guess, and then if it's like with his blood work being normal and everything, that would probably show like if it was Ehrlichia, wouldn't he have like an elevated, or like have low blood count, low platelets, or is it okay for his blood work to kind of come back normal like that?
The short answer is yes. Okay. We can have dogs that do have infectious causes of CNS disease that don't necessarily have other blood work abnormalities. I think the way for us to better corroborate whether their Ehrlichia has anything to do with it, or not, is that MRI and spinal tap. And we're kind of saying gut feel it probably has nothing to do with it, and that's just kind of seeing lots of things frequently, but we can't be sure without further testing of whether the Ehrlichia is related or not.
And then since I have you guys, like the somatic nares and neurological, do you guys ever see like a kind of a Dave, come here. Do you guys ever see a correlation between the two, like the nares and I know like ear, nose, and throat, they all kind of correlate with one another. Is there any kind of relation to the nares and the neurological components of that?
I'm going to say firm no on that, pretty much. Okay. Other than the fact that we see a lot of Frenchies, but they just get both problems.
Okay.
He was saying we see a lot of French bulldogs, so
yeah.
I'm making a bad.
They're just neurotic in general. So okay, awesome. Thank you guys so much, and hopefully the neurologist can kind of give us a heads up. So definitely we'll keep looking into it. His heart, she did say his heart and lungs sounded great too on the exam. So hopefully maybe an x-ray or maybe a little picture of his brain will give us more input. So thank you guys. Thank you guys for having me on. I'm grateful for this. Thank you. It was very, very helpful for me. So thank you so much for your time.
Good.
You're very welcome. I love his bandana. I think all dogs have a neck or two.
Yeah, right. It adds character to them. Oh yes. So thank you guys again.
Thank you so much.
You're very welcome.
Bye guys.
Bye.
Okay. Good luck. Bye.
All right. So speaking of French bulldogs, we've got Duke, a 9-year-old French bulldog. Hey, Dave. Hey, Wendy. How are you?
Hi.
Tell us about Duke.
Yeah, Duke.
So Duke is 9 years old, really active. About 2 years ago, he fell, and when he did, he broke his jaw right on the lower part of his jaw in the middle, sheared off a canine tooth, and then as a result of that, he had to have surgery and have several teeth removed. But ever since then, we started noticing like some tremors in his back leg. And when he first came home, we noticed a couple times that he would be laying on the couch, like sleeping or on the floor sleeping, and he would almost dribble a little bit of urine or something, once in a while. And we first thought maybe they had put a catheter or something in him, but they said that they hadn't. So we didn't think a whole lot of it initially, and he healed up, and he'd seen the vet several times since then, and we kind of asked about that, and it was just sort of dismissed as maybe it's arthritis. Dogs kind of get tremors when they get a little bit older. But now what we've started to notice, especially in the last year, he still occasionally will have the like urine dribbling or whatever, but now we're noticing the shaking is really bad. And it's gotten to the point where sometimes he'll even be walking along and it's almost like his leg gives out and he kind of falls over, or it's one or the other of his rear legs kind of slips when he's walking, or he might even walk like odd, like instead of a normal gait like he normally would have, you see him walk strangely just because it's almost like he can't control the leg. He doesn't really show pain. So we've had a hard time trying to, just determine whether it's painful or whether it's just, problematic for him, but we don't really know. So this last appointment, we had him into a vet. We moved since then over to Montana, and we live in rural Montana. So the vet stuff over here is somewhat a little bit different than in a bigger city. They don't see a lot of French bulldogs. And so we just recently had some x-rays done, and the x-ray report came back and they diagnosed it as IVDD, and they mentioned specifically that he had like some chronic disc disease in the T10, T11 through T12, T13, and also L7 to S1. So when we were talking to the vet about the diagnosis and stuff, we were trying to figure out what exactly we do with it. When they showed us the x-rays, the spinal cord up in the back going into the neck has a really pronounced arch to it, something that the vet felt was maybe genetic. Although as I look back on it now, I almost wonder if that didn't occur when he fell on his head and broke his jaw. If that could have been, the cause of why that particular arch is in there. I don't know how well you can see on this camera, but I might be able to hold it up there. So there's the arch going into his neck. And so now we're at a point where the vet kind of feels like there's nothing else they can really do short of, steroid treatments or something of that effect. The next option for us would be a 6.5, 7 hour drive to Spokane to go to the vet college, but we don't know whether or not they'll even see him. We're waiting right now for results and whether or not they'll even look at him. And what we were kind of hoping was for them to maybe look at his x-rays and stuff and his diagnosis and say, hey, that's not something surgically we think we could even correct, or yes, it's something we think we should look at, but we don't know. And so because he's 9, we're not really sure what to do with that, and my fear obviously is if we leave it and we just continue to do what we normally do, which he runs around, he hikes with us, he does all kinds of stuff. Will this get progressively worse and cause him to be paralyzed, or cause, is he in pain? And, so we have all these concerns, but we really don't know what the answers are. So that's kind of where we are with him.
Yeah. Okay. can I just ask you a few other questions? When you see him walking and having difficulty walking, do you ever see him like scuff or drag, sort of scuff his toes?
Yeah, he drags his rear toenails all the time.
Yeah. Okay. And have you ever noticed, in addition to the pee, does he ever like drop poop out when he shouldn't?
No, he hasn't had any issues like that. Not, at least not right now, anyway.
Okay. And the pee is just sometimes when he's sleeping, is that right?
Yeah, if he's not even necessarily sleeping, he might just be laying there, you know, and he'll just sort of dribble a little bit of urine. Now,
Christmas he did
standing. The most recent time he did it, yeah, he was actually just standing there in the living room at Christmas time, and he just sort of dribbled pee, you know, and so we try to take him out frequently so he can go to the bathroom and stuff, and we try not to let him drink a lot of water before bed and that kind of stuff. And for the most part, we don't have like a lot of issues with that, but we definitely have seen that increase a little bit over the last year or so. The toe dragging and having his foot just kind of like slip out to the side when he's just, even if he's just standing there, sometimes it looks like it slips out from the side. Or he'll shake, you know, like when he goes to shake off or something, and he'll knock himself down, you know, in the back because he can't hold himself up.
His legs get out.
But yet he still runs around and he likes to go hiking and he does all that kind of stuff. He just clearly isn't as strong as he used to be in the rear. And he, like the other day we took him out he was probably with us for a mile and a half. And normally he's really good at that distance. And he was rolling around in the snow and he was just having a good time playing in the snow. And then he stood up and he just sat there real weird with one of his legs kind of cocked off to the side, and he wouldn't get up. He wouldn't walk or anything. I had to pick him up and carry him. And after I carried him for a little while, he got down and he started walking again, and he still had the same toe issues and foot issues, but he was at least trying to walk. But that's the first time I've ever seen him like completely stop. We have seen where he won't jump on the couch or he won't jump off of something, and that kind of comes and goes depending on the day, but it's definitely different than it used to be.
Yeah. I mean, it sounds to me. Maybe can you mute your phone? I think that would help. Yeah, thank you. It's really disconcerting to get like the echo, which probably I've been doing to you too. It sounds to me like it would be consistent potentially with a problem in his spinal cord. That, you know, I don't think it's, from what you're describing, doesn't sound typical for anything like arthritis or a joint problem or, you know, leg problem. And the key there is the fact that he's, you know, maybe a little wobbly and scuffing those back toes. And that's pretty strong evidence that it's nervous system involvement and probably his spinal cord if his front legs and his sort of up here looks fine. A few thoughts on that. I know the question on the screen here is that indicative of a disc herniation? I would say it could be. It certainly is the most common cause of spinal cord compression in dogs. The fact that this has been going on for a while, take some of the other things that we worry about in terms of the spinal cord off the table. Like, I don't think, sometimes we'll see dogs that have, for instance, like a vascular problem, like basically a little like a stroke in their spine. And that's usually a very sudden thing that doesn't linger for long like this. We can see, unfortunately, dogs get tumors that press on their spine, and those can sort of happen and go on for a little while, but they tend to get worse over the course of a few months, and so it'd be unusual for it to linger for a year longer. If I were prioritizing things, I think it could be, I think a disc would be fairly high on that list. There is another condition that I'm a little concerned with. Dr. Wong is nodding his head, and I think we agree on this, and that is this very strange thing called, it goes by different names, but arachnoid diverticulum is what we tend to call it, which is a crazy name. And maybe that's not what he was thinking of. That's what I was thinking of. That is it's kind of hard to describe. It's easier to draw it, but basically it's sort of a little outpooching of the space that that spinal fluid flows in around the spinal cord. And you can sometimes see that as a congenital problem, a problem that dogs are born with. But in Frenchies and occasionally in English bulldogs, but not so much, but Frenchies and pugs are big dogs here. They can acquire these sort of in middle to older age. And so 9 years of age, 7, 8, 9, 10 years of age would be right there. Most of those guys have actually a problem with fecal incontinence as well, which is why I asked you that question. But they don't have to. And that is also, it tends to be very, very chronic like that. And again, Frenchies are really, it's becoming very common in that breed actually. And sometimes you see it in combination with a disc herniation. You know, you'll have a disc herniation as well as this arachnoid diverticulum. It's sometimes called an arachnoid cyst. So you'll may come across that terminology as well. I want to say a few other things based on the points, and again, Mike, just reel me in here if I'm talking too much. But I think that any sort of deviation in his spine that you saw in the X-ray is probably not related to the trauma that he had, and probably just some. Unfortunately, Frenchies also get very commonly congenital abnormalities of their spine. We see it all the time, and a lot of the time it's completely incidental. In fact, sometimes you're shocked when you see the spine of a 5 or 6 or 7-year-old Frenchie and it looks like it's falling apart, and they've been like that their whole life. It's quite shocking, but it's the way it is. So I think that that's just probably completely unrelated. I don't think his trauma is related to this. I think going forward, probably your highest yield ways to go would be to consider, if you're able to, maybe making the drive. I thought, by the way, the school was in Pullman. Well, the main school's in Pullman right now. So I've been there actually, well, some time ago. But it's a ways to go, I realize. But the highest yield tests likely for Duke's situation is probably going to be MRI. This is going to be a common theme for us, I'm sure. But that's really the best test to actually look at the spinal cord itself. X-rays tells you, it's absolutely valuable information, but you can't, you don't really see the spinal cord itself. What you see is the bones surrounding the spinal cord. And so the MRI is going to provide you with just a wealth of additional information there. It's really the only test that's going to realistically probably going to allow you to make a diagnosis of this arachnoid diverticulum thing. So that would be probably the highest yield test, likely. A few other things I want to say. This particular condition, the arachnoid diverticulum, thankfully is usually not a painful thing. So even when these dogs, and it can progress, but it often does progress very slowly over time, and not all dogs need an intervention. I'll say that. Opinions vary widely on this. I tend to be, I'm just going to get this out of I tend to be a fairly conservative person in terms of recommendations for surgery in general. And so, surgery can absolutely help some of these dogs, but to me, it depends on, their age, how they're doing otherwise, how functional are they, how likely you are to make them worse, because those are all concerns. But the good news is that particular condition doesn't tend to be painful. And then the last comment I might just make, and again, we're not really in a great position to be providing great, treatment advice to you without seeing him and all that sort of stuff. But I would say the highest risk activities for him, I don't know that you need to keep him strictly confined, which is sometimes recommendations that we make, but I think you should think about avoiding real high risk behaviors, and the highest risk behavior for me is jumping off of stuff in particular. So like jumping off the furniture, out of a car or truck, you know, stuff like that, real rough play. That's stuff I would definitely avoid. And I think I would maybe try and confine his activity to sort of controlled leash walk stuff if possible, at least, especially until, you know, if you decide to make that drive over to Washington. That's about all I've got.
Yeah, you hit all the things that I was writing down when Dave and Wendy were telling us about Duke. So, you know, just the sounds like neuro disease, and I guess what do we see commonly in 9-year-old French bulldogs, you know, with this kind of slowly progressive chronic, you know, 1+ year, and you know, the urinary incontinence. Yeah, arachnoid diverticulum would be highest on my list. I'm glad you talked about sort of utility of radiographs and IVDD. I feel that's a common question, at least we get here a lot of, you know, people come with radiographs and say, you know, my dog was diagnosed with a slip disc, and many times they might be right, but we can only truly diagnose a slip disc and rule out all of these other things that it can be. You know, in Duke's case and in other dogs' cases, you know, spinal cord strokes, meningitis, myelitis, tumors, malformations, etc., with an MRI. The arch in the back was, you know, another thing that I wrote here is, yeah, it's almost certainly incidental, and it's not from the fall. I mean, if
I wasn't sure if it was me. Oh, it's,
there we are.
oh yeah, it was you.
Emily fixed it. And then, yeah, I guess the last question that I think, you know, would help you and would help other people is, you know, well, gosh, I've got this 9-year-old dog, you know, what do I do? When do I make the decision to do something different? And, you know, it's very easy when something dramatic has happened, you know, where they've gone from not walking to walking, or they've had a seizure or something like that. But yeah, I totally get it with Duke of, you know, well, he doesn't look terrible. He's running around in the snow. He's otherwise, you know, not painful. And to me, the times to go for further testing, you know, obviously if something's dramatic, but if things aren't getting better and they're keeping you up at night wondering, gosh, is there something that we could be doing for Duke that we don't know? You know, to me, that's enough reason for the peace of mind, even if it, you know, we might find something that can't be fixed, or we might find something that, you know, you're doing everything that you can already. But I can tell, I mean, the reason that you're on here right now is you're worried and you're wondering, is there something else that you can be doing for him? And, you know, I don't think we're truly going to know that unless we've got the time machine to go forward, you know, 5 years from now and see what happened, or meet with a neurologist and potentially get some diagnostic imaging, i.e. an MRI, performed. So.
And I will say they do have a good group at Washington State as well. I know it's a small community, veterinary neurology. So they have a solid group up there. So.
Yep. I've got you on mute, Dave. If you had another question, let me take you. Did you have any other questions, Dave?
Yeah, so I guess I just kind of wanted to recap that. I mean, our intention is to go to Pullman, not Spokane, but Pullman. We sort of just lumped them together at that point. If you're driving that far, what's a few more miles to Pullman? But we intend to go there if they'll see us, you know, but I just wasn't sure. Is surgery like a normal type of thing? Because, you know, I've been trying, of course, to Google it, but like anything else, when you Google it, suddenly you're pregnant and you have all these other issues that you found on Google that must be what's going on with you. And so we were just trying to get some information before we make that drive, so we're a little bit better educated about what to expect. Because if we drive all the way over there and they diagnose it as something else, I mean, should we be like thinking that, yeah, this, even if it, let's say it is the diverticulum or even the IVDD, I mean, is that is that likely that they're going to recommend surgery on a 9-year-old dog, or are they going to say, no, you should try to crate rest him and you should try to use a steroid or or a non-steroidal approach? I don't really know. And part of it, I mean, honestly, is a cost factor as well. If you told me it was $10,000 for surgery and it's unlikely to do anything for a 9-year-old dog, I would have a harder time making that decision than if you said it was $10,000 and he's going to run around for several more years. But I mean, obviously we can't guarantee anything.
Yeah, those are all the factors that we take into account. So I mean, you're asking all the right questions. For us, the process is, and again, I'm not sure if you can actually see my hands. So you know, is it a neurological problem? And then from there, well, how bad is it? And then what is it? And based off of that, those are some of the pieces of information that we use to say, well, are we going to recommend surgery or not? So, you know, is it a surgical problem or not? But then all the things that you said are things that we factor in. Well, gosh, well, what's the likelihood of it helping versus hurting? What's the likelihood of having a successful outcome, you know, in a 2-year-old dog versus a 12-year-old dog? So that's where I guess I try and coach people to look at it in steps. Step one is, well, let's try and find out what it is, and don't necessarily get ourselves talked out of finding out what it is and what we can do because of worrying of, well, gosh, we're not going to do surgery anyway. So if you go, you know, the first thing they're going to do is examine, and they'll have all of those thoughts of, well, what could it be, you know, and based off of cost and age and anesthesia and things like that, they'll have that conversation with you to make that decision. I totally get it that you'd like to have an idea before driving 6 hours of what direction you might be going. So from there, if it's a slip, so let's talk about the things that it could be. Well, let's talk about the two things: slip disc. If it's a slip disc, at 9 years of age, if it's getting worse, and you know, if I know he's not painful, but you kind of described these couple different episodes where he didn't want to walk. The MRI also helps me make that decision. If I see a whopper of just a really big slip disc that I say, gosh, you know, that's the source of the cause, or the cause of the symptoms, and I think that doing surgery is going to make a significant difference for Duke, I'll talk to you about that, and you know, give you a percentage as much as I can, you know, of whether it's a 50% or a 90% or somewhere in the middle. If it's if it's an arachnoid diverticulum, that's something where, to me, the jury's still out a little bit on what the correct or best treatment is. I think some of that is that, I won't call it a new condition, but you know, it's something that we're recognizing more and more frequently over the last 10 years. And in that it's, you know, newer for us, there aren't strong treatment recommendations. There is a report that came out recently that kind of compared dogs that had surgery versus dogs that didn't. Wasn't necessarily a perfect study. I looked at, you know, tons of dogs, and but there was a suggestion that surgery did have a better long-term prognosis. But for me, when I'm seeing these dogs, you know, I'm taking into account, well, how severely affected are they now? How long has it been going on? I actually like to see how big the diverticulum is. We can also see some other changes in the spinal cord that, you know, again, there's no proof of that. No one's done a study to predict which ones are going to do well and which ones aren't. But to me, the MRI does help me coach a pet parent through, hey, if this were my dog, I'd be leaning towards surgery, versus if this were my dog, you know, we've got a diagnosis, we know what to expect, but maybe surgery isn't, you know, the best thing for your particular dog. So kind of a long way of saying I would encourage you to try and get the information of what we're dealing with Duke, but don't psych yourself out with overthinking and overanalyzing. Well, gosh, what am I going to use the information with, and am I going to do surgery, and what's it going to cost? where we're at right now, in my opinion, with Duke is, we don't know what the underlying cause is. And it's harder to answer the questions of, will they get better? Is it medicine? Is it surgery? Without that information.
Okay. I appreciate that. I mean, it was just last week that we had him at the vet and got the results from the x-rays and stuff. And so we're still waiting to hear from the Pullman clinic whether or not they can see him or when they can see him. Of course, it snowed like 4 inches today, so it's perfect to drive over. But
I have no idea what you're talking about. So
yeah, it's that white stuff that falls from the sky and makes the roads really slick.
We got snow yesterday for the first time this year. So we only get it once or twice a year. So
in Florida.
Exciting. I'm in North Carolina, so.
Oh, okay, all right.
So, yeah.
I was envisioning the beaches covered in snow, and I didn't quite get that, but
That's weird.
So if we can get an appointment over there, for sure, the MRI is the next step. But okay, well, I appreciate it. We don't have much information over here. It's a new vet that we just started taking him to, and to be honest with you, we were kind of surprised because he's been seen by 3 different vets over the last couple of years since he broke his jaw, because our original vet over in Washington couldn't get him in for surgery, so we had to take him to a different vet. So during the course of that, he's seen 3 different vets, and all 3 of them we've asked about, like his leg shaking and that kind of stuff. And this vet is the first one that actually came up that was more than like arthritis. So we were a little bit taken back by that. And then we started, of course, Googling more of it.
Well, so I guess for me, and it's a similar question, for Dave, we saw a dog named Dave right before this. That tremoring of the legs is actually really hard for me to tell people what it means. So, the last 3 vets where it was just, tremoring of the leg, that can mean a lot of things. And, it isn't something, well, gosh, they missed this obvious thing. It's when you start telling us things like he's walking wobbly and he's scuffing his toes and dribbling urine, where Dr. Mariani and I say, we're comfortable from afar saying it's probably a neurological problem. We can't be sure even from here, but it just from your description of those things sounds like a neurological problem. But if it was just in your description, Duke's leg tremors or trembles, we may not have been quite so bold to be talking about arachnoid diverticula and things like that.
Okay. All right.
Yeah, I agree 100%.
Perfect.
Well, thank you very much.
Thank you.
You got it.
Take
care.
Well.
All right. Take care. Bye-bye.
Good luck. Bye-bye.
How you holding up?
I'm good. Quick question. I thought this was an hour. Is that right or no?
Yeah, we're a little behind, and we've got Martin here. If you need to bolt, I can continue on. But
yeah, normally I would not mind at all staying, but I have I do have something I got to do at 2. I have a meeting. It's been a crazy week. So, and also I want to say, I noticed all these questions streaming along here, many of which I really want to answer, but
yeah. I guess while I've got you, because one of the questions is about seizures, causes of brain tumors. Can you give us a 2-minute version on low motor noise as causes of seizure or causes of brain tumors, and I guess causes of seizures and causes of brain tumors in general.
Yeah.
And then I would love to hear, because I haven't seen it in the comments yet, but I would love to hear NC State's opinion on things like CBD oil for seizures and stem cell for IVDD. 3 minutes, go.
Yeah. Sorry, Martin, we hijacked this here. Yeah. So brain tumors, favorite topic of mine. Can we do like a whole brain tumor session?
Let's do that. We'll bring you back on and we'll do it just about brain tumors. Is that Can we do that, Emily?
Yeah. Oh, that would make my day.
All right.
Okay. Yeah. The other stuff, stem cell therapy, it's still 100% in the experimental phase. That is definitely not my wheelhouse. One of my colleagues here, Natasha Olby, is sort of one of the spinal cord injury gurus, and she has done some trials in that realm, although I don't believe she has anything active at the moment. So still firmly in the sort of experimental therapy range. Sorry, tell me, what was the...
And CBD.
Oh, CBD. Oh, gosh, yeah, can of worms there. This is a super interesting topic. Of course, any advice on this is fraught with danger because of the regulatory problems between states and federal, if you're in the United States. And of course, there's a difference between CBD and THC, et cetera, et cetera, et cetera. There's, super interesting data on this, of which I'm not intimately familiar with, but, CBD oil product has been licensed for use in human, at least a certain human population for seizures. So it's definitely intriguing. There's definitely some evidence of efficacy in this realm, and people are starting to do some studies in dogs. The biggest problem in this space is quality control, right? And so because everyone and their brother can make a product, call it CBD oil or some version of that, and sell it, the problem is you're not really sure what you're getting. So that's, I don't know, that's the 2-minute version on that, I guess. So I'm optimistic for the future on that front, but I'm just cautious because right now it's kind of a Wild West. And I'm sure there are some excellent companies, but I'm also sure there are some charlatans trying to sell people stuff that that is probably just oil. Yeah.
All right.